This is Radio Health Journal. I'm Nancy Benson. This week, curing the cold that won't go away.
I have patients who will say, every cold turns into a sinus infection. That's usually because they have some narrowness of their passageway to start with, and so they have very little room to tolerate congestion.
Colds, allergies, and sinus infections when Radio Health Journal returns.
Chronic pain affects nearly 100 million Americans. Research has shown quality of life can be transformed for some patients by spinal cord stimulation, but many systems remain complex and can be a barrier to meaningful pain relief. The FDA recently approved a new patient-centric spinal cord stimulation system known as the St. Jude Medical Proclaimed Spinal Cord Stimulation System. Dr. Dennis Patterson of Nevada Advanced Pain Specialists.
A spinal cord stimulation system shouldn't disrupt life. The St. Jude Medical Proclaim system is intuitive to use, wireless, and discreet. It was clearly designed with patients in mind, and we've seen firsthand in my practice that it can improve the overall therapy experience.
To take the next step to learn more about the newly approved Proclaim Spinal Cord Stimulation System, go to poweroveryourpain.com/nextsteps. That's poweroveryourpain.com/nextsteps. Implementation of a spinal cord stimulation system can involve risk, such as painful stimulation, loss of pain relief, and surgical risks, such as paralysis during the implantation procedure. Patients should talk to their physician to determine if spinal cord stimulation therapy is right for them.
It's spring allergy season, and most predictions are that it could be one of the worst ones ever. Most places around the country had a relatively mild winter, and that's given trees and other pollen sources a running start in creating respiratory misery. Some people who thought they never had allergies before are starting to wonder, is that persistent stuffy nose really a cold or something else?
Typically, if somebody reports a lot of body aches, or we call it systemic symptoms, in other words, fevers, chills, body aches, that's not typical of allergies.
That's Dr. Lisa Liberatore, a board-certified otolaryngologist specializing in sinus and sleep issues at Totem Health in New York.
Then you know you've got some type of infection happening because you won't get a fever with an allergy. And then the longevity of how long those symptoms last for will sometimes give you a clue as to whether it's viral or bacterial. Very often, a person may start with a viral infection, and what I'll tell the patient is it's been more than 7 to 10 days, and then they start to see yellow, thick green mucus coming out, or they're coughing heavy. Then usually a bacteria sort of secondarily chimes in after the person's immune system has sort of been weakened by the viral infection.
If it is a cold or other viral infection, don't expect an antibiotic from your doctor. It wouldn't do any good anyway. You just have to ride it out.
If you've got cold-type symptoms, runny nose, kind of aches, you can start just by using your mother or grandmother's advice. Rest, fluids, saline, mist in the nose can help move the mucus through the nasal passageways, and a decongestant can help also relieve the symptoms.
But what if you're one of those people whose colds never go away, or whose colds always progress to something worse? Liberatore says it's likely you've got a structural problem in your sinuses.
I have patients who will say, every cold turns into a sinus infection. That's usually because they have some narrowness of their passageway to start with, so they have very little room to tolerate congestion. And that's from the infamous deviated nasal septum, where the partition that separates the right and left nasal cavity may be more over to one side or the other, and the side that it's crooked or deviated over to would be typically the side that the person would then get a secondary sinus infection on that side. Because now there's two problems why people get sinus infections. One is if there's too much mucus being produced and it sort of overwhelms the cavity, or there's not enough room for that mucus to drain. And bacteria love stagnant mucus. It's like bacteria food.
That's what makes chronic sinusitis keep coming back. Antibiotics don't get rid of the bacteria breeding ground.
That's the person who keeps getting sinus infections or takes an antibiotic and may feel better, but as soon as they're off the antibiotic, they feel like they get sick again. They just kind of keep going in this cycle of antibiotics. Okay, I feel okay. And then maybe a week later, back to the same thing. And the chronic sinus sufferers typically don't have pain. They don't complain about pain. Very often they don't even realize why they're feeling sick or headachy or dizzy. They may complain more about postnasal drip or mucus in the throat or the feeling of having to clear their throat all the time. Chronic sinus sufferers are very often relieved to find out that's why they're feeling the way they are, because they have a chronic sinus problem, which means that their head is filled with mucus or thickened tissue in the sinuses, which does not allow the sinuses to drain properly.
Liberatore says people with chronic sinusitis often end up with symptoms that affect their quality of life even more than they realize.
We have a statistically significant quality of life questionnaire. It's called a SNOT-20. I didn't make that up, but it stands for Sinonasal Outcome Test. It's not 20, and it's 20 symptoms that patients rate from 0 to 5. 0 is never have a problem, to 5 is severe as you can. And they rate 20 different symptoms, and they range from nasal congestion, postnasal drip, maybe loss of sense of smell, but then they continue to lack of productivity or difficulty focusing. I love doing that before and after surgery because patients don't realize that what's become their new normal is not normal.
Liberatore says many primary care physicians are aware of only the two ends of the sinusitis treatment spectrum, antibiotics or full-blown sinus surgery. But today there are smaller steps in the middle that aren't as drastic as surgery, yet are much more effective than antibiotics.
The baby steps can be things that we can actually do in the office to create more space where the sinus is drained. So we can use a tool called balloon sinuplasty, which is the same principle that's used to open up the arteries of the heart. That was the same idea that somebody had to create to dilate the sinus passageways. So a little wire is placed through the nose after anesthetizing the nose, and then the balloon is inflated, and then that dilates that sinus opening. You're not actually removing tissue, just dilating it. And then the balloon is removed, and then I use a irrigating cannula through that opening, and the patient leans forward over a container, and we flush the sinus out, because very often I use the analogy of it's like a pimple. We have to pop the pimple. We have to get all that material out of there.
Once the sinus is open, Liberatore says the next step is to be sure that it stays that way by placing some inflammation prevention at the former source of the block.
That's a great little device called a Propel, Propel, and they came up with the idea of a little mesh which opens up into the passageway that you've created, and it has steroids on it which elute or which leak into the area for 3 weeks' time. So over 3 weeks' time, you're getting a little bit of this anti-inflammatory material right at the site that you're trying to reduce inflammation.
These days, even sinus surgery isn't as bad as most people think. Liberatore says doctors don't have to break your nose to fix a deviated septum. And once surgery's done, they no longer use packing to stop the bleeding. So recovery is much less painful. So she says no matter why people have a constant stuffy nose, now there's something they can do about it. You can find out more about all our guests on our website, radiohealthjournal.net. Our production director is Sean Waldron. I'm Nancy Benson.
Radio Health Journal returns with medical notes in just a moment.
Can you imagine not being able to see? Nearly 250 million people worldwide are blind or visually impaired. 80% of visual impairment can be prevented or cured, but 90% of those affected live in countries with little access to quality eye care. The solution is Orbis, a global nonprofit organization which has trained thousands of doctors and treats hundreds of thousands of patients in 78 countries aboard their Flying Eye Hospital, the world's only ophthalmic teaching hospital on board a DC-10 aircraft. This summer, Orbis will launch their brand new Flying Eye Hospital, an MD-10 state-of-the-art, fully accredited eye hospital with enhanced teaching technologies. Orbis invites you to celebrate this milestone in aviation and medicine. For just a $25 donation to Orbis, you can get a behind-the-scenes tour of the Flying Eye Hospital and experience a piece of aviation history this summer in Los Angeles, Memphis, New York, Washington, D.C., or Dallas. Visit orbis.org/launch to make your donation. Register for tours and to learn more. That's orbis.org/launch.
Medical notes this week. The first uterus transplant in the United States made headlines when it was performed in late February, but the uterus had to be removed from its recipient just 2 weeks after it was implanted. Now doctors have revealed that a common yeast infection was the cause, resulting in a compromised blood supply to the new organ. The Cleveland Clinic, where the surgery took place, has put its uterus transplant program on hold for now. People usually think of their digestive health when they take a probiotic, but before long, they may take one to prevent cavities. A study in the journal Applied and Environmental Microbiology focuses on a previously unknown strain of Streptococcus bacteria called A12. Scientists say A12 does two things that dramatically lower acid in the mouth, a major factor in cavities. First, it kills other bacteria that create acid, and it also metabolizes arginine, another major acid creator. Researchers say a probiotic with A12 could help promote oral health. And finally, a few years ago, many of you responded to a story we reported about Noah Van Houten, a little boy struggling with Batten disease. That's a rare genetic neurological disorder that gradually robs children of their sight and motor skills. We told you about the foundation Noah's parents established, noahshope.com, to fund research into what is for now a fatal disease. We're sad to report that Noah died of Batten disease complications late last month. He was 11 years old. And that's Medical Notes this week. More in a moment.
A new survey shows a staggering number of family and friends of people with Alzheimer's disease are jeopardizing their own family's health and financial stability. According to the Alzheimer's Association 2016 Alzheimer's Disease Facts and Figures report, nearly half of care contributors have to cut back on their own expenses and basic needs, such as food and medical care. Beth Kallmeyer is Vice President of Constituent Services for the Alzheimer's Association.
Very few people are prepared for the high cost of dementia-related care. More than one-third of care contributors experience significant lost income due to caregiving demands. For example, they must cut back on their own expenses, including basic necessities like food, transportation, and medical care.
Kallmeyer says families need to proactively plan for the financial impact of Alzheimer's and dementia. Planning tips and more about the 2016 Facts and Figures report are available at alz.org.
Thank you for listening to Radio Health Journal, a production of MediaTrax Communications. If you enjoyed this week's show, please leave a review on iTunes or share it with a friend. You can find more Radio Health Journal stories about health, science, and technology on iTunes, Stitcher, and at radiohealthjournal.net.